I lost my dad last year, and he had a kidney transplant several years ago. And one of the challenging things was when I asked the doctor, like, hey, why didn't we try this other medication? They couldn't try it on him because they didn't have any data on what it would do to the kidney and other aspects of it. So Oncoforma is a biotech company that gives better decision-making points to oncologists and surgeons so they can pick the best treatment for cancer patients right off the bat.
The process involves getting a tumor sample from individual cancer patient, getting from this tumor sample individual cancer cells, and then growing them in three-dimensional organoid models, and then using these organoid models for testing a collection of available clinically approved drugs.
We can figure out which drugs have a positive impact, which have a negative impact, which have no impact, and then provide this data to the oncologist or the surgeon and increase their chances of success with a successful treatment the first time around.
If you talk about traditional approach again, when drugs would be tested manually, that would not be feasible. That would take years. Here, this is a scalable approach using organoids in combination with a robotic facility, and we can do this in weeks.
Oncoforma is revolutionary because this hasn't been done in Canada before. There's a handful of companies that do this worldwide, but nobody's doing it at the scale that we want to do. The couple of commercially available solutions are out in the US, and they do a panel anywhere from 20 to 40 drugs, and 100 is really pushing it for them. So right now we have the capability of testing about 1,800 drugs against these organoids. That hasn't been done before.
Most benefits would be outpatients across Canada and then eventually internationally. So, if we select optimal treatments from the beginning, that would also save a lot of money for our healthcare system.
We're an early stage company, but we've been able to move really fast because of investors like AgWest Bio and get funds going so that we can get moving along with the startup, which I think is super important, and they're playing a super vital role in the healthcare space and ag space here in Saskatchewan.